Exactly 5 minutes past the top of the hour. Welcome back to Good Morning Kenya. Time for our last conversation of the day. We explore women in leadership, basically what they are doing in their spaces of influence as well as places of leadership. To help us converse around that and so much more for the next 30 minutes or so is Judy Oyuyo to my far left, who is an evangelist on set. We also have Dr. Peter Hayombe, who is a public health consultant. Lady and gent, welcome to the program.
Thank you, Doreen.
Thank you.
Let me just start with you, Judy. I have described you as an evangelist, but there's a lot that you do.
Yes.
Who is Judy?
Judy. I knew that question was coming. Judy Oyuyo, evangelist. Well, I go by Judy. Judy Oyuyo. I'm Kenyan American. I'm based in Houston, Texas, and every year for the last 13 years, I have been coming to Kenya to do community outreach events. Typically, I ship 2 months before I come. For the last 3 years, I ship sanitary pads, adult diapers, baby food, and gently used clothes and shoes to give to the needy. I go to the slums because to me, when everybody wants to give in CSR, corporate social responsibility, they go to homes. I don't do that. I do street evangelism, slum evangelism. And before the promulgation in 2012, in 2010, I went to all the 8 provinces with the exception of Northeastern. My dad and mom told me, Judy, don't go to Northeastern, it's not really safe. But I met with Reverend Francis Omondi and I gave him food. And I do the same thing across the board. So,
why did you feel the need to want to do this? Because just before the promulgation, before we got the counties, I mean, visiting all the 7 regions,
right, with
the exception of the 8th one, the Northeastern,
correct,
and going to the slum areas to, give foods and dignity packs.
Why did I have the need? Because I broke my neck in 2004 on Good Friday, April 9, 2004. I broke my neck. When I was in the hospital ICU in Atlanta, Georgia, at Kenneth Stone Hospital, I told God, I said, Father, when you heal me, I will go to the nations to show them not only how much you love Judy, but how much you love the world. And so for me, God, I used to come to Kenya like 2005, the first time I came to speak. I go to churches, I go to Nairobi Pentecostal, I go to Old Don Bosco, name it. And when I go, I minister in the youth sanctuary and also in the men's sanctuary. And then people come to me, Judy, pray for me, I need a job. Pray for me, my dad and I don't talk. Pray for me, I need a wife, I need a husband. So those needs people were asking for, and many times even when I came, actually I didn't have a job then, but God had made it such a way that he kept me unemployed for that period. Then I'd come, I do my thing, I go back. But then I had a second accident in 2004, and I asked God, no, this is too much. I was mad with the second accident. So that's when I got the mandate from God and the vision to come and do this in Kenya. I don't think I've heard of anyone who does this from America, coming back to their country to do this. I think I'm the first. So I'm a trendsetter, I think. So that's what I do, and I would see the need of the people, and for me it's such a burden because I hate to see anyone suffer, especially the children. And I know some men, they give children 100 shillings and say, hey, ugilana na mimi nita, I'll give you this, which is terrible. So for me, I wanted to help them and meet them at the point of need. After I meet them at the point of need, then I'm able to gospel, preach to them.
Yeah, and we'll talk more about that, meeting them at the point of the need, particularly when you talk about adolescents, teens as well. But let me bring you, Dr. Peter, on this one. Talk to me about where you come in this program.
Okay, my name is Dr. Peter Hayombe. I'm a public health consultant. So I have a company called Simba Education Consultants. In that consultancy, we work, we make profit. Now, part of our profit, we have apportioned to helping the needy. So that's how I met Judy. And of course, when Judy invited me to be useful in her campaigns to provide information on sexual and reproductive health and family planning issues for the adolescent girls and young mothers. So that's how I come in to be her partner in meeting out and reaching out to the people. Yes.
So then, Judy, do you do this as an individual or, there's an institution? How do you do this?
So I speak to motivate, because what more can we do than just speak? So after the second accident, I asked God, there's gotta be more that, when I'm talking American, there's gotta be more I can do than just speak about these testimonies. According to Revelation 12:11, they overcame him, the devil, by the blood of the Lamb, Jesus, and the words of their testimony. So I was like, But how come whenever I talk to people, whether I'm in America, I go to American churches or Nigerian, Kenyan churches are many in America. But when I come to Kenya and I go to churches, everybody wants me to pray for them. I'm like, God, there's got to be more. And I was seeing they need. So I asked God to give me a name. And the name he gave me for the ministry is Speak to Motivate, because what more can we do than speak? But it is based off of Matthew 25:41-46 and James 1:27 that talks about the orphans and the widows. So I saw the need and I was like, okay, I can do something about it. So that's who I am. I'm Speak to Motivate. And I go to schools too. Like now I can't go because they're on holiday until I think 2 weeks time, 14th, right?
24th. 23rd.
Yes.
So then you do this as an individual.
Correct. Through my ministry, which is the ministry that I lead and founded, which is Speak to Motivate.
Speak to Motivate.
Got it.
All right. When did you found this?
Speak to Motivate was founded in my apartment in Dallas in 2008. So it's been how many years? 15 years now?
15 years.
Yes.
Which year did you come on board Daktari?
Yeah, we've been with Judy for quite some time, and most of the time I provide her with information that she is able to relay. In fact, she is now doing it in a cascading way. Like when she'll be leaving, the team we met at Kayole, there are ladies that I've already provided them with the curriculum they're going to use for sexual and reproductive health and family planning. So we work like I give information or I give part of my time to go and speak to the ladies or the adolescent and teenage mothers on sexual and reproductive health issues, because that is like my main public health area.
Yeah. And I mean, you're a public health consultant, so ideally this would be your forte.
Yes.
When you say you give information to Judy, is this information of what really happens in the country or really just towards this area of public health in the areas that you visit together?
A bit of it is also on research, for example. Or what was the prevalence of, say, teen pregnancy, or what's the prevalence rate of maybe mental illness that are affecting teenage girls or pregnant teenagers. And then from this, that one part of information. The other part of information is now the hardcore. What are some of the family health options that they can have? And when they are able to go through this, and of course there are several, like I said, cascading, I train people who then now train these teenage girls in the various spaces where Judy has created.
Yeah, I hear you. Judy, since 2008, just going around in Kenya mostly, and of course the slum areas, how has your experience been? Because you realize when you talk about issues, particularly surrounding girls and issues of teen pregnancies, they just never end. And the giving of dignity packs, as well as you call them, sanitary pads, much as the state would get and employ ways to do this, but still, it's a problem.
It is. Yeah. It's a big burden. Yeah. And initially, for the last 11 years, I've been doing this for 13 years now, practically, going to the slums for 13 years. Now, the 11 years of that was mainly orphans and widows and needy adults. But of late, God has changed it to where it's now more wazes. I've been to Nyumba ya Wazee also, and I've been to Muji wa Huruma in Runda. And teenage mothers. Yeah. So how has this been? It's been very, the need never ends. So I would like even to partner with people who make disposable, not disposable, sorry, the organic, I don't know if they call it organic, biodegradable sanitary pads that are more affordable, not only for the women, but also for adults. Adult diapers are super expensive. I have a ton in my house in Houston. I'm going to send them, ship them, but I need help. We need help to provide more affordable baby diapers and adult diapers, and of course sanitary pads. It's a never-ending need because every woman, he's not shy, has menstrual cycle. So what are you gonna use? I hear in the beginning I found out that even people use cow dung, they use leaves, they use even newspaper or old cloth, which is not very hygienic, and it also can create a health hazard for them. So it would be good to partner with even the government. If they can do this, please help. because it's such a big need. Some girls don't go to school when they're on their menstrual cycle.
Yeah.
So they miss upwards of...
Even in this day and time.
Yes, so 12 weeks of school they miss. But yeah, that's divide by 4, it's how many months? That's a lot of time away from school. So yeah, it's a never-ending need. It's always be there. It's always be there.
Yeah, you want to jump in?
In fact, I like the way you mentioned that the state has been providing, and of course this has been a very good project in the previous regimes and probably this other one. You find that they are out of school youths who also need this. So when they reach them through schools, there's still some gap that you can see Judy's talking about that they can be able to reach, because these are the government project now cannot reach them because they are out of school. And these are also very needy that the project which is targeting school don't meet. Yes.
I hear you. Judy, you talked about baby diaper, adult diaper. Someone would be asking, adult diaper, why?
For was they?
Yeah.
You know, some people who maybe they have incontinence, maybe how is it that they cannot urinate on their own.
Yeah.
So in order not to spoil their intimate garments, panty or underwear, then they have to wear a diaper. Some of them maybe have kidney problems, so they cannot just hold it. It's just, you know, urinate in a talker too. So baby adult diapers, it's a diaper. It's like a baby diaper. Basically, that's what it is. And there are some, they're made for men and they're made for women. They're not in between. Yeah, so, and I have many in my house. I want to ship them. And another thing is the bedpan, not the bedpan, the mattress protector. That one also, I don't know if anybody manufactures that in Kenya, but you need a mattress protector, because obviously sometimes maybe when somebody is sleeping, they can soil the diaper. It can be full. They don't have control over their
Is this what we call the Macintosh?
I don't know what the Macintosh is, but it's like maybe this size, and it covers the mattress of where they're sleeping. So that also is a big need. It's a plastic thing with a lot of foam in it that protects the mattress from being soiled. So that's also another thing that is needed to bring dignity, as you put it.
Yeah, to bring dignity.
Yeah, because how many people, I remember even me, I'm going to say this without any embarrassment, they found out I had I had fibroids. So for 5 months, from November 2020 until March 2021, I had nothing but 5 months of bleeding. 5 months of bleeding. I had to wear diapers.
Non-stop?
Yes. And in America, the way the medical healthcare insurance works, you have to wait for the doctor to open up, a specialist. I had to wait to see my OBGYN. I couldn't just go and see my OBGYN. You guys call them gynecologists here. It was horrible, but I had to wear a diaper. So now that's what I'm talking about. Maybe sometimes people have issues that they cannot control, and you know, by providing this, you give them dignity. Because if when you go outside, you don't want eggs. Where will I go to the restroom? They can just use that. They have another one in the bag, and they go. Then they go and dispose of that. So that's what I'm talking about. It's really for Waze.
For Wazes. This is also where your heart is drawing.
This is what God has now put in my heart for the last 2 years. Yeah.
But initially really began with adolescents, orphans, widows, and teens.
Correct.
And when you talk about teens and adolescents, looks like we'll center quite our focus a bit there momentarily. So then, is this specifically girls, or is it
even boys.
Both genders?
Even boys, because even on Saturday I had a motivational talk with some youth in Kisumu via Zoom. And I'm such a technology girl. I've been doing this technology for the last maybe 15 years. Via Zoom, and they asked, and I asked them, how many of you in the room have a need for sanitary pads? Then the pastor, Father Paul, said that 200. I said, I don't see 200 people. Tell me the number. They told me 40 girls. So this is what I'm going to do. Through one of my sponsors, I'm going to provide sanitary pads. I have a major Indian sponsor for the last 13 years. She gives me food, she gives me rice, she gives me sanitary pads, never says no. Then I have another one who gives me food, produce, with vegetables and stuff and fruit, and then another one gives me wine tablets. But for the boys, and the boys, what about us boys? I said, okay, Edwin, what do you want? We want footballs. And it's true, because when they're idle, they get into mischief and start having teenage sex and become teenage mothers and teenage fathers. The women end up being single mothers because the boys are overwhelmed and they don't have a way to provide for this child and this woman that they have impregnated. So they leave. So now I work with the youth also, but like I'm saying, it's going to the boys and the girls. I don't neglect the boys. So we need footballs.
Yeah, I love that. I love that you really cut across, because oftentimes you've talked about programs for girls, and the burning question has always been, what about the boys. And I like,
Yeah, that's true. A number of projects and helpings have gone to girls.
Yes.
And it's like skewed. But I like the fact that now people are coming out to also approach boys, like First Lady now, having projects that are geared to supporting boys also. And of course that would make it neutral, and both of them are rich at the same time.
So that we empower both genders, in tandem, not that you really do one at the expense of the other, then one feels neglected at the expense of the other. But then you've also been out in the field, definitely with Judy, with the various programs. What challenges are you spotting when it comes to the youth or the young adults?
Okay, in fact, you would find that youth are somehow not very motivated to live. So the motivation is very low.
People have lost hope.
Somehow the motivation is very low because when they were going to school, they probably just thought for themselves, I'll get to school, I'll get the certificate, I'll get employed. But now this is not coming forth. So because of this, you find the youth are not motivated, youth are not able to churn out what God really gave them, so that they bring out their self to be productive in the society. Apart from that, you find that youth also, because of idleness, they get involved in a number of social ills. They would involve in drugs, and these are things that get them out from their normal social life. You also find that relationship between youths and their parents, and of course the community, is degenerating or reducing. And this is also a challenge. Because of this, you find that socializing within communities is really reducing. This is why you find that when you go to communities, you will just find youths seated or idling somewhere in markets. They would ask you for money instead of thinking of going to look for money for themselves. Yes.
And I can really see Judy agreeing totally when you say that the young adults have lost hope, the relationship degenerating. But I want you to jump on that one momentarily. But before you get to do that, I still want Dr. Peter to tell us more on that one. When you talk especially about youth losing hope, it's one of the things that you're also spotting when you go out there in the field. What would you say is really the biggest reasons to this?
Okay, for a long time, our education system has been geared to actually getting your certificates and getting employed. We've not brought in this practicality that you can do the blue-collar job. So because of that kind of training and education, which CBC is coming in to correct, you find that we are not motivated to do something, but we wait for employment. So our education system, which is now being aligned, will help that kind of problem. Yes.
So what I hear you say is lose of hope is simply because of not having somewhere, or how should I say, not knowing the next step. Like you're done with your coursework, your schoolwork, and you don't know.
Yeah, and it gets down to somebody who is still at secondary school level, seeing university graduates still with them at home. So that makes them to even lose hope and motivation. Yes.
That's why Judy has the program of more And you're really heavily agreeing with what Dr. Peter...
because I've seen it. I mean, for the and look up. This is just God. Because how do you explain that I live in America? You guys are here, but I'm seeing the same things that you people see.
And you're very much aware of what is happening.
Yes. And well, I watch news from America, but I don't need to watch news to know what's going on. I'm in touch with my mom. My dad died 2021, so Daddy also was a very significant part of what's happening. And you know, always said, "Hey, Judy, this is happening. Judy, next time maybe you come." He's interesting. Thank you, Judy. Maybe next time you come, do this, do this. Judy, maybe does the youth this? You know, so even parents need to step up and, like he's saying, help the children. Because just because your child did not go to university, you can tell them, hey, look, you can do this ABCD. When we went to Kayole with Peter, we went to Sabasaba, Kayole, which is a big slum in Kayole. We met the bishop there is Bishop Kitui. Bishop Kitui is doing an amazing thing. He is actually providing tertiary education. So I asked the girls at the end of the program, we're there from, I think it was 12 until about 4 So we took food with us, we motivated them, we prayed, we danced, and I met some street acrobats. And just by, me, I'm a very outgoing person.
Yeah, clearly you are.
I saw them, the roundabout right there in Eastern Bypass in Kileleshwa.
Yeah.
These boys literally, when the lights stop, the traffic lights stop, they start doing their acrobatic moves. So I'm like, I was watching them. I think it was maybe my second day in Kenya. I said, but you guys, Auntie, don't you think you're exposing yourself to danger? You guys are not scared of being knocked by the cars? They didn't know. Even the police has told us we can move on the side, do on the pavement. I'm like, okay. I told him, you know what, I have an event on the 19th, and I want to involve you guys. So I paid them each. There were 5 of them, 500 shillings, and they came with us. In fact, they rode in one, me and him rode in one car. He came with his driver, and then I paid for them from Yaya Center. We just picked up an Uber with Fred Libako, and we went to Kayole. When they went, they really got the children excited, the young mothers, and even some of them were being thrown up to the ceiling, and not really up literally, but how they do this strip, I don't know, it's like tier, like 4 tiers, human beings, and then the top one is a teenage mother or her daughter. It was so amazing to see. So those are some of the things. Don't just think that your children just can only go and become doctors or nurses or whatever. They can use their music talent. They can use their hands. So Dr. Kitui, every 6 months, he trains these mothers. I ask them, what have you learned from today? What have you learned from being a teenage mother? What mistakes did you make? And where do you want to go? I learned that some of them, they are happy. They're selling adult diapers, baby food, and for that one I'm going to provide to her what I have in my house and support her that way. There's one who's selling mitumba. I have a lot of gently used beautiful clothes. I'm going to send that to her and continue to support her that way. Some are making, they're doing catering, dressmaking, hair making, whatever. So it's as he says, you can train in other things. Go to technology schools. Polytechnic is still there. I hear it's an university now. There's so many things. And some of these universities, please partner with us. Provide free education. Provide scholarships. If somebody cannot help financially, please, afford it, help them. Like Equity Bank is doing amazing thing. And maybe they have something. Maybe we need to approach Equity Bank because these children need to not lose hope.
Yeah.
Because it's going to be a vicious cycle. Because you got it from your mother, Sasa you're taking it to your teenage, you're a teenage mother, your children, and then what? It will be passed on because they don't know any better. But there's so many things that you can do. Kenya is a beautiful country. There's so many opportunities, but it takes money and connections.
So the whole idea is not to lose hope.
Don't lose hope.
Yeah.
If I didn't lose hope when I broke my neck, come on.
And the second accident as well.
I've been in 3 accidents actually. I've lost how many cars have I lost in America? Many. So if I cannot lose hope and I come all the way from America to do this, don't lose hope.
You can't afford to lose hope.
Life is too short and too unpredictable. And God has a reason for all of us to be here. We all have a purpose.
Yeah. I'd also want us to talk about the programs with the teen moms and the adolescents. But before we get to do that, I also want to bring you on this one, Dr. Peter. Yes, I know Judy has really spoken a lot about it, and even giving examples which you've equally touched on. But this is cutting across both genders. When you look at how young people are losing hope, is this only just boys? Is it boys and girls? How would you describe from the different places you've been in the slum areas in Kenya?
As you already indicated, it's for both boys and girls.
This actually has no gender.
It has no gender because some of the issues we meet are similar, but it now gets worse to girls because when they engage in premarital sex, then they have a baby at that young age. When they are not prepared psychologically, they are not prepared socially, economically, and therefore they are not able to even bring the child they have given birth to. And it also begins from the fact that when what they would call accident occurs, when they get pregnant, that is, which is not actually accident, when it occurs, the relationship that they have with their parents, as well as the relationship that they have with the community changes, because now people see them to have gone through, it's now they've done some social ills. So the fact that relationship has changed, they get into stress, and some of them go further to go to trauma, because people see them in that wrong light, which actually may not be, is not necessary. So for girls, it's more because of that, and boys escape because nobody would know who was the father of that pregnancy. Now, because of that, you find that girls have okay, they face the same problem, but now girls are more because they have more burden. And this differs also in terms of the different, say, part of our country. You find that a lot of the teen pregnancy is very high in other places and very low in other places. You also find that it's also different among social classes. We have more teenage pregnancy at the lower quartile, while the upper quartile, there are no major pregnancies.
Hold that thought there. I want us to take a very quick breather, Dr. as well as Madam Judy. When we circle back, we explore more on that as to why we will have other regions having low and others high, and what you spotted when you go out in the field, and basically what you're doing in your different capacities of leadership and influence to bridge that. Due for that break, we circle back with plenty more of this conversation. Stay with us.